Welcome to today's web chat about the fourth trimester, also known as the first 6 weeks after childbirth. My name is Ali Novara, and I have the privilege of working with the Women's Health Program at Von Voigtlander Women's Hospital. I will be your host for today's chat. Pregnant moms spend a lot of time learning what to expect from pregnancy and how to care for their newborns. While pregnancy anecdotes and birth stories tend to dominate conversations at baby showers and get-togethers, the challenging aspects of the fourth trimester are often left unsaid. We are here today to help moms gain the knowledge and confidence they need to take care of themselves physically and mentally after giving birth. We'll introduce our panelists in a moment, but first a few housekeeping items. You can submit questions at any time, even now, for our panelists to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via Facebook or email at ask-mishmed@med.umich.edu. If you can't stay for the whole chat or want to share the recording with a friend, a video of the chat in its entirety will be available on our Facebook page and posted to the Michigan Medicine YouTube channel soon after. I'd like to introduce you to our panelists now. Dr. Carolyn Swenson is a urogynecologist who staffs our Michigan Healthy Healing After Delivery Clinic, which was the first specialty clinic of its kind in the U.S. to address postpartum pelvic floor issues. Dr. Swenson specializes in medical and surgical management of pelvic floor disorders and sees patients in Ann Arbor at the Von Voigtlander Women's Clinic and the West Ann Arbor Health Center, and in Midland, Michigan at the Mid-Michigan Health Center for Women's Health. Dr. Katherine Rosenblum is a clinical and developmental psychologist with the U of M Department of Psychiatry. She is the co-director of the Women and Infant Mental Health Program and sees patients at the Rachel Upjohn Building in Ann Arbor. Dr. Rosenblum's interests include mental health in pregnancy, infancy, and early childhood. Jen Shifferd is a board-certified women's health specialist who is co-lead of the Michigan Medicine Pelvic Floor Program in the Department of Physical Medicine and Rehabilitation. Jen helped to develop the pelvic floor program at Michigan Medicine and currently sees patients at the Brighton Center for Specialty Care. She treats patients across their lifespan for constipation, urinary and fecal incontinence, pelvic floor pain, pelvic organ prolapse, scar adhesions, and core muscle weakness. Thank you again for joining us. We'll open up the floor now for questions, but I'd like to remind our audience that you can submit questions by commenting on this video directly, by direct messaging us on Facebook, or by emailing us at ask-mishmed@med.umich.edu. We will not use your name when we read off your question, but do know that if you comment directly on this video, your name or profile name will be visible to other participants. Okay, so the first question. What are some of the common concerns women have about their physical and mental health after having a baby?
I can go ahead and comment on the physical health after having a baby. And part of that depends on the route of delivery, so whether it was a vaginal delivery or a C-section, because each of those routes carries different physical changes. But the biggest question is, will my body ever be the same, whether it's a vaginal delivery or a C-section? And so part of the role of your OBGYN and clinics like Michigan Healthy Healing After Delivery is to help women get back to regain the confidence that they had in their body. If they have any kind of symptoms that need addressing, like urinary incontinence or fecal incontinence or pelvic pain, it's our job to help get women back to where they want to be physically.
And I can speak to that in terms of mental health, because the sort of birth of a child is a very powerful, significant experience emotionally and biologically. And with that come a whole host of feelings that women very typically experience. So we hear often about women experiencing something that people often refer to as the baby blues, which actually is very common in the first week or two following delivery. and is probably associated with many of the biological changes and hormonal changes that occur through childbirth. I would say this is in the research approximately 85% of women who experience the baby blues, but for a significant number of women, 10 to 15% nationally, but more for women at risk, these blues really can elevate into something more significant and concerning that we refer to as postpartum depression. And I hope we'll have a chance to talk a little bit more about that today, because it's a very common occurrence and one of the most sort of commonly occurring complications post-delivery. So something that we should all know about and be aware of.
And I can comment in regards to the physical aspect, being the physical therapist on the panel. In regards to that, women following delivery can have a variety of complications, as Carolyn mentioned, and we really look at the whole picture. We look at the whole person. We not only check your pelvic floor, we're also looking at your spine and your alignment and how things come back together after delivery, as well as for any separation in your abdominal wall, which is called the diastases. We're looking, when you see a pelvic floor physical therapist, we're checking everything, and we'll also look at what's happening with your pelvic floor following a vaginal delivery regarding any perineal lacerations or weakness that may be occurring, or pain issues as well. And if you've had a cesarean, we can address those adhesions and retrain your abdominal wall. So.
Great, thank you. How long does it take to physically heal after giving birth? And I'm going to add a second one in there. How is physical recovery different for a vaginal birth versus a C-section?
Should we tag team this one?
Yeah.
Okay.
Yeah.
So the first question was, how long does it take for your body to recover? And again, this is a question that I get commonly from patients. And I usually start by saying the vast majority of the recovery is done within the first 6 weeks to 6 months. So we know by 6 months, over 90% of the tissue remodeling and changes in the pelvic floor and abdominal tissues has occurred. So this is kind of what we would consider the new normal baseline for a woman's body at that point after delivery. But keeping that in mind, tissue remodeling can take 9 months to a year, so it almost takes as long for a woman's body to recover from a delivery as it takes to get her to be ready for a delivery. So I usually tell that to patients too, to put it into perspective that although it's easy for us to want a quick fix and the baby's out, now we want everything to go back to normal, it's really a process that takes months and months. And not that you're not going to feel better before 1 year, but it helps put things into perspective for patients.
Mm-hmm. I agree with that. And in regards to the rehab aspect, when you see a physical therapist, you may be seeing a physical therapist for up to a few months, sometimes a little less, sometimes a little more, depending on even how things were before having the baby. So if you had weakness in your muscles before and experiencing stress incontinence where you cough, sneeze, and have leakage, or even urgency where you're having to hurry to the toilet or having issues with your bowels, it may take a little bit longer, but we address all of those things. And also looking if you have any pelvic organ prolapse to help in reducing that. So Kegels alone can help reduce things about a centimeter or so, but we also have other techniques outside of doing Kegels to help restore that muscle tone and help in reducing pelvic organ prolapse. With rehab, we're also always looking to reduce pain first and establish a normal muscle tone before we begin a strengthening program. So it's really important that those things are addressed before Kegels even begin. There's a lot we do before Kegels.
And I will say, just to add to that, if a woman has had a more severe perineal laceration, or a prolonged second stage, which is the time when you're pushing, there are various factors that could kind of prolong the healing process, and so just to keep that in mind as well. Typically, if there is especially pain that persists past 6 weeks, that would be a reason that we would want a woman to come in and either talk to her OB/GYN or come see a urogynecologist to kind of see what's going on, because that would be an indication that the normal healing process is not going as it should. And usually there are things we can do for that, like pelvic floor physical therapy, depending on what the issue is.
Great, thank you both. Okay. We'll move on to the next question. What is your recommendation on herbal blend, ginger, Epsom salt, or plain sitz baths after birth?
I can take that one as well. So I usually recommend just warm water sitz baths with nothing added. And that is because anything that you put in there could be a potential irritant, especially something like Epsom salt, that I think would just be really irritating and probably painful for a woman who has a perineal laceration. So my recommendation is just warm water sitz baths, so just sitting in a couple inches of warm water, either in the bathtub, or you can purchase a sitz bath that goes on the toilet, or you can just use a detachable shower head and just kind of irrigate the area for about 10 minutes, 2 to 3 times a day. Once the skin has healed, you can stop doing sitz baths, but that warm water really promotes healing. It kind of cleans out the wound, helps prevent infection and promote healing. So, and it can really feel really soothing. So, just warm water is what I recommend.
Great. The next question is, how long will I bleed after birth?
That is for me as well. So this varies, again, depending on the type of your delivery. It can vary from anywhere from like 2 weeks to 6 weeks or a little bit more. And what you want to, so I wouldn't be concerned if you're still having bleeding at 5 or 6 weeks, as long as that amount of bleeding has been decreasing over time. It's very common to have no bleeding, and then when you're nursing, have some increase in bleeding. That's just because the hormones that are released to help you let down your milk also cause uterine contractions, and so you have a little more bleeding with that. So that varies, and again, it's normal as long as the overall volume is decreasing over time.
Thank you. Can you talk about some common pelvic floor problems?
I can say that.
Go ahead. Take it away, Jen.
So some things you might experience, if you've had a prolonged pushing phase during labor and delivery, you are going to experience some different pelvic floor issues, possibly weakness because you're stretching that pudendal nerve that innervates the pelvic floor muscles, so there can be what's called some latency there, and that can contribute to weakness. Just carrying a baby alone puts pressure down through the pelvic floor and can put stress on those ligaments that help to suspend your organs. So that feeling of pressure down in the pelvic area, can be pelvic organ prolapse, and that is a common thing for women to experience after delivery as well. When you have a tear, we've talked a little bit about tears, that happens at that perineal body, which is the tissue between the vagina and the rectum, and depending on the grade of the tear, it's up to 4. 4 is all the way to the anal region. That can determine as well what's going to happen with your pelvic floor. If it tears all the way, you may have problems with containing gas or stool. And those are things that can heal and can be repaired, and through proper rehabilitation can be improved significantly. And other things that can happen, obviously, if you have tearing, you can have pain as well. And scars as they heal, can adhere a little bit. So we teach women right away how to start massaging that scar. And that's something you can do about 4 to 6 weeks after delivery once it's fully healed. And you can even wait till your OB visit to talk with your doctor about that to make sure it's fully healed and you can start massaging that scar. And we usually recommend, if this is the vaginal opening and here's my rectum, that perineal body is going to be that skin in between. And we have women massage that back and forth, back and forth. You could use a little bit of vitamin E oil as you do it, not while it's dry, but that's something I always would encourage people to start doing. Scar adhesion can happen as well with a cesarean incision. any incision, you always want to massage perpendicular, not parallel to it, so you don't open it. But with a cesarean incision, usually those take about 4 weeks to heal. You might have steri strips on it. Those should have already fallen off, and the incision should be fully closed before you ever attempt to massage that. But that is something that we encourage women to do. So with a cesarean, you may experience abdominal weakness. You will experience that with a vaginal delivery as well, just for the fact that your abdominals have been stretched with carrying a baby. And that's another part of the rehabilitation process. When that happens, when your abs are weak, you're going to then rely primarily on those low back muscles as a primary stabilizer for your trunk. And it can cause some back pain because of the imbalance, so it's not uncommon to also have back pain. There's a lot of wonderful things that happen with pregnancy. Obviously, we get to have the joy of having our child, but these things that happen to your body, you do need to have rehab for that, and it is recommended. You can talk to your physician, 6 weeks following delivery about that to get a referral in. Other things that you may experience are constipation or fecal leakage. That is another area that we can address and retrain those muscles and actually retrain you the proper way to position, to have a bowel movement. And also, if you're having pain in that area, we'll of course be addressing that as well. So,
Great, thank you. Looks like we had another question come in. This is my 3rd pregnancy, and historically, even though I've breastfed and watched my diet, I get very bloated, swollen, and gain weight in the 4th trimester, which is discouraging. I suspect it is hormonal. Do you suggest any additional supplements in the 4th trimester to avoid this?
I don't know that there are any specific supplements that I would recommend. I would just say that overall, there are a lot of fluid shifts and hormonal shifts that happen after you deliver the baby. And so in that early postpartum period, part of the leg swelling can be related to those fluid shifts. And usually you might also notice your urine output significantly increases in the first couple of weeks after you have a baby. And that's your body's way of getting rid of all of that extra fluid that you needed when you were pregnant. And that you're trying to get rid of. If the leg swelling is persistent, I would say that sometimes can be a sign of something called preeclampsia, which commonly we think of as a pregnancy problem, but this also can occur in the postpartum period. So I would, just to be safe, go see your OBGYN and get your blood pressure checked. They might get a urine test too to test it for protein, but otherwise, as long as that is negative, I would say I would just be reassured that it will get better, but I don't recommend taking any specific supplements.
Thank you. What is pelvic floor physical therapy and or massage?
So pelvic floor therapy, to be a pelvic floor therapist, once you've graduated as a physical therapist and you have a license, you're a generalist. You're kind of, you have a general understanding of all the different areas of physical therapy. To go on to be trained for women's health, you take additional courses, additional training beyond earning your physical therapy degree. And with pelvic floor physical therapy, we really are looking at the whole person. As I mentioned before, we're looking at the pelvic floor muscles, their coordination, their strength, and any pain issues, and how this is affecting the symptoms that you're coming in to see us for. Now, massage, when we're talking about massage, physical therapy, we do a lot of different hands-on techniques. I talked a little bit earlier about we do scar tissue releases. We also do internal trigger point muscle releases, just like you might have a trigger point in your neck or your back. We're going to work on releasing those tight areas internally as well. For women trying to get back to being able to have intercourse, we also teach you how to use vaginal dilators to help you stretch at home. It's really important in physical therapy that we teach you how to also manage things at home, because what we do alone in your weekly physical therapy visits, it's not enough. You also have to be your own advocate and be independent with the things we give you at home. And we're there to help you along the way, and all of this is new for you, we know. And so those are some things that we can do. So in relation to massage, you're really going to be experiencing more gentle stretching, whether it's vaginal or rectal, internal trigger point releases where it's a little bit of a static hold, scar type work, and that kind of thing.
Thank you. Dr. Rosenblum, I'm going to direct this next question at you. My baby is now 10 months old, and I still worry about him whenever I'm not with him. Other moms have told me this is a normal feeling I will experience for the rest of my life. Is this normal, or should I seek out mental health help or guidance?
Well, I'm really glad that we're asking the question also about anxiety in the postpartum, because I mentioned earlier that postpartum depression is very common, and that is true. But it's also true that women experience heightened levels of anxiety and worry, and oftentimes in the postpartum period, this is one of the sort of most significant things that women will tell us they're experiencing. A couple of thoughts about that. First, after the birth of a baby, we actually have some really wonderful, amazing work that neuroimagers have done, looking at the brain of mothers and actually fathers too, following the birth of a child. And what they find is that after the child is born, the part of the brain that lights up is related to anxiety or OCD circuits that are more active. And what that means is that you're more likely to be worried and sort of preoccupied a little bit with, how is my baby doing? Is my baby okay? Is my baby safe? And there's probably some evolutionary advantage to that. We want to be a little bit worried about our kids so that we know that we're taking care of them and to doing, what we need to keep them safe. But sometimes this anxiety can cause stress for parents and for new mothers that's maybe more than we would expect. And when it's really interfering with a person's ability to return to other important tasks and things that they need to do in life, and they're experiencing a significant amount of worry, I would suggest that that's a time where it would be really important to talk to your provider or to come to a clinic to talk with someone about those feelings and to do some screening and to think about whether, in fact, there might be some options for treatment that might help to alleviate some of the unnecessary worry so that there's more pleasure and ability to enjoy this period of parenthood.
Can I ask a follow-up question
You
about
bet.
that? Because
Sure.
I get this, because I see patients around 2 weeks postpartum often, I get a lot of comments about that very thing. And I experience the same thing with my kids. And, it's like I have to check on them every 20 minutes at night to make sure they're still breathing. And patients tell me that same thing. And, it passed after a couple of weeks and I was able to stop doing that. But is there kind of a normal time frame that we can give patients to expect, like, if this doesn't resolve in a month or, that might be something we need to readdress?
Yeah. I'm really glad you brought it up. And I'll add something to that, actually, because something that often I will hear because I ask, and people don't always ask this, is I'll even ask people about, are there things that you worry about, like that you might hurt the baby or that something bad might happen to the baby? And what we know is when we ask those questions, first of all, we're not putting any ideas into anyone's head, so it's really okay to ask. And actually, the opposite is true. People really often hold those feelings in and worry that even just having these passing thoughts might mean that they're a bad mother, that they might act on them, that there's something bigger to be worried about. Actually, those kinds of worries and concerns that sort of come and go are very, very common and are associated with what I talked about, the part of the brain that sort of turns on to make us hypervigilant. That said, if those feelings are really persisting, that you've had them for several weeks, 4 weeks have gone by and you're still finding yourself really anxiously preoccupied and worried, I think it's really important to talk with somebody about that, to get a sense of, is this sort of crossing a line into something where I might want some extra help or support? I like to ask people about what they're feeling and what they're experiencing, because the other really important thing here is that mental health concerns in the postpartum are often very undetected. And we know that if we don't ask the question, how are you feeling? How are you doing? And even beyond that, sometimes people say, you know, that although this is really a wonderful thing that the babies come, they're also struggling with feelings of being sad or anxious or difficulties with sleep. And I wonder if any of that's happening for you. If we don't ask those questions, oftentimes what happens is women don't tell us. There's a lot of shame. There are a lot of myths about motherhood, that this should be sort of the most joyful time, and that there must be something really wrong with you if you're having these feelings. So when we ask the question, we open the door to healing, because there is help and there is hope for having those feelings be addressed, supported, and not as debilitating.
Well, and along those lines, I do want to say from my clinic, because we do a postpartum depression screen, so we often catch women at risk for postpartum depression kind of earlier than they would have been seen if they just went to their 4 or 6 week postpartum visit. And anytime there's been a patient that I'm really concerned about, and I need to get them to see one of you in the perinatal mood clinic, I can always get them in without a doubt. You guys are very accommodating, so thank you for that.
You
That's
bet.
an invaluable resource for us.
It's a priority for us because this is a really important time, and we know that time is of the essence, that when women are suffering during this period, it really interferes with an important time in their life, and their baby's life, and their family's life. And so at the Women and Infants Mental Health Clinic, we make every effort to get women in a timely way. And I want to say I'm also very glad that at the University of Michigan, OBs and gynecologists are routinely screening for depression, and that is so important. It really is a standard for the field, because if we don't ask, then oftentimes we don't know.
Absolutely.
In follow-up to that question, can you explain the difference between postpartum depression versus the baby blues?
So it's really, I think, a good question, because as I mentioned earlier, during the postpartum period, the body has gone through such a tremendous change, and this whole cascade of hormones really does contribute to, you know, some really intense feelings. And I would say it's hormonal, and it's also just the birth of a child. You know, your life is it's really rocking your world in these profound ways. And so having, you know, emotional sort of swings, having some, you know, periods of tearfulness and feeling overwhelmed, crying, that sort of thing is really, really common during the first 2 weeks postpartum. There are a couple of things that we want to pay attention to, however. One is, does this sort of remit? Does it end after 2 weeks? If it extends beyond those 2 weeks, we're not talking about baby blues anymore. We really need to be thinking about the potential for a postpartum depression. The other thing that we really want to pay attention to is the severity of those mood swings. How significant are they? If these are really big shifts in mood and there's really extreme lability, or the person is behaving in ways that are causing concern in significant ways or worry to others, that's really important to pay attention to and could be a psychiatric emergency. And we refer to that as postpartum psychosis sometimes. When people have really significant mood swings, it interferes with their sort of thinking reasonably about what's happening for the baby or for themselves. That's also not depression. That's a different sort of concern. But if that sort of really significant lability is happening, we want to make sure that you're calling your provider and getting in to see someone quickly. If the sort of moodiness lasts longer than 2 weeks, it would be really important. You can talk to your OB and you can let them know what you're feeling. You can share concerns with others. I think the most important thing is to talk and let people know that this is something that you're struggling with, and to know that there's help, that there are things that can be offered that can really address those symptoms. Postpartum depression is something that, as I said, affects, you know, approximately 15% of women. So it's common, and it doesn't mean you're a bad mother. It doesn't mean that there's going to necessarily be harm to your child. But what it does mean is that you're suffering and that you really need the help and support of treatment.
Thank you. Biologically, when are we truly ready to be separated from our babies? So, for example, to return to work.
I think that's good.
That's a big question. So, the return to work is such a big stress for so many women.
Absolutely.
And I think that it's undoubtedly one of the things that I hear most often from parents is a source of worry and concern, like what is it going to be like when I return? So I think the first thing I want to say is to go easy on yourself and to know that this is really, really a hard thing. In some countries, there's more protected time for families in the postpartum, and I frankly would wish that for the women, fathers, and children in our country. I think it is very hard to go back to work. I think you certainly should be talking with your provider about your medical readiness to go back to work. And if you are really struggling, to really think about whether there are options to delay or defer the return to work and not to add that sort of burden. That said, you know, I see it time and again that women do make the transition back to work. And, you know, that can vary in terms of when they do that. What's generally true is that it's hard. And so I just sort of want to put out there, I think it's less about just the biological readiness, but also about the support that you're receiving, the opportunities for sleep, who's helping with the kids, how are you addressing issues around breastfeeding, and what kind of support are you receiving for that, if that's something that is important. And I think really thinking about the context of support is critical.
Thank you. How long after pregnancy should a couple wait before having intercourse?
I could take that one. So in general, we say nothing in the vagina for 6 weeks after a vaginal delivery. And that's even if you've had no perineal tears or, you know, you had totally easy delivery, which hopefully happens. And the reason for that is because the uterus, which is, is big enough to accommodate a 7 to 8 pound baby, has to involute back to the size of your fist, or about the size of a pear. And so that takes time to do that. It takes about 6 weeks. And during that process, you know, the lining of the uterus has to shed, and the inside of the uterus is more exposed to the vagina during that process. And so the real reason one real reason is to prevent infection risk, so prevent endometritis, which is an infection in the uterus. A second reason is because up to 80% of women will have some sort of perineal laceration during a vaginal delivery. So lacerations are very common, and they may be minor. As Jen mentioned, there are kind of 4 types of lacerations: first, second, third, and fourth degree. And a first degree is just a little cut on the vaginal skin, and then you have a fourth degree, which is a complete tear from the vagina all the way through the anus. And so, you know, any laceration will take additional time to heal, and you certainly don't want anything producing friction on the repair or potentially compromising the repair that's been done on that perineal laceration. That's not good for wound healing, and that's going to be really painful. So in general, 6 weeks. Sometimes it's a little bit longer, depending on the type of laceration that a woman has had.
Can I actually go back, pardon me, to
Absolutely.
the question? Because I just had a thought, but I don't know if you wanted to add anything to the question that was just asked.
So
Is it
regarding
in
the
your domain?
laceration, yeah. So in regards to when to have intercourse, you know, I think we see a lot of patients that they're definitely avoiding it because it's painful just to sit, and to honestly think of your partner entering there is like, forget it. So we really work with patients in the pelvic floor rehab to help you gain that comfort back. You know, going back again we work with us, teaching you how to massage your scar. We also use vaginal dilation to help with the stretching and work up to the size of your partner. And you know, once you've gained that comfort back and it's less painful to even insert a dilator, you know, then we encourage patients to try intercourse at that point. You know, I think it's important to wait until you're ready and to not feel pressured. I'm sure your partner realizes what your body's just been through. So I think communication is key, and that's an important part. But you can get back there. It just takes time. I will often have patients bring their partners in so they can kind of see what they're doing, and sometimes also help out with parts of the therapy as well.
That's very helpful information.
So I just wanted to go back, if that's okay, to the question, because I was thinking about the question that was asked about the return to work. And
return to work. Okay, I'm sorry. I thought you were...
No, that was good. I wanted you to be able to talk. That was the question. The prior question was in both of your domain. So I was just thinking about the return to work question, and how a lot of times I think one of the things that people worry about is feeling guilty that it will harm their baby, and worried about, you know, the baby's attachment to them. And I think I just want to speak to that briefly, to say that we actually have quite a lot of research that tells us that children whose parents work, whose mothers work, are perfectly capable of having wonderful, loving, closely bonded relationships with their parents. And so, you know, I think that I don't want to minimize the challenge that families face in having to make that transition, and including maybe feelings of sadness or loss about not being able to be home at that time. But I also want to reassure families that the things that they're doing, the loving on their baby, the support for their baby during those early months and years, still has the effect of really creating a really wonderful bond and attachment for the baby with their parents, and the outcomes can be very, very positive for kids in that situation too.
Did you want me to comment on the word?
Sure.
Is that right?
Yeah, go ahead.
From the physical, not just the mental aspect, but the physical aspect as well. That's another reason why it's important to go to physical therapy. You know, we also look at what your physical activities are at work and at home, and teaching you the proper body mechanics with lifting. And, you know, now it's a little bit more difficult getting the babies in and out of their crib because they don't drop down anymore, which is so disappointing, because boy, that was so much easier when my kids we could do that, because you can actually bend more appropriately. But we also work with, you know, the proper way for holding your baby with breastfeeding, and working on body mechanics, and, you know, bringing baby to breast, not breast to baby. And we also have a blocked milk duct program as well for women. I just wanted to that's a bad word to say, plug that in there, but there you go. But it is, you know, I think you should also feel not just mentally ready, but physically ready. And from a full-time working mom perspective, I have 2 boys. It's good to get back to work. It does bring about even a little, you know, adult conversations, and you've worked hard for your degree.
Yeah, that's right.
So it's okay.
That's right. Yeah. And women experience that in so many different ways, I might add, right? Like some women might really feel like, I really need to have this sort of transition, and that's wonderful. I think the important thing is the support.
Right.
And I'll just jump on to add, the things that you're talking about are so important, not only for the body and physiology, but also for the mind and for mental health. And so we actually do know that when women have experienced complicated births, when they have many physical pains or sort of things happening in their body that are causing stress or discomfort, it actually increases risk for depression and anxiety in the perinatal period. And so I think really, you know, attending to your body and making sure there's space for
because as moms, I mean, we put ourselves last most of the time.
Right.
Absolutely.
I mean, seriously.
Yeah.
So we never have time for ourselves, right?
And we have data on that from our clinic in postpartum depression. So we found that women who have urinary incontinence and pelvic pain had a higher rate of having a positive postpartum depression screen. So, you know, those are 2 kind of unique postpartum pelvic floor risk factors for a positive postpartum depression screen that hadn't really been identified previously. So it's really important, if you have any of those kind of symptoms, to get care for those things, because
Yes.
they can definitely contribute to your
Right.
mental health.
Absolutely.
Well, and I think what's also interesting to me about this, because we're talking about a whole, broad range of things, but they're all really very connected. And the other
Yeah.
thing that I think can be really connected is some of the barriers that prevent women from getting the help
Accessing
that
care.
they need, right? That, in fact, oftentimes women will experience feelings of shame, embarrassment, isolation, guilt, some sense of worry. And also, these aren't the things that people always come and talk to you about, right? They come with baby gifts and, baby showers, but no one is necessarily talking to you about pelvic floor issues and concerns or mental health. And
Even moms and daughters or girlfriends. I mean, it's just not something that is commonly discussed.
I will say though, once our patients have gone through pelvic floor rehab,
Then-
it
right.
is the
Then
hot
they're
topic
advocates.
conversation at any little luncheon or happy hour that's happening. The word gets spread around. But I do want to mention, if I can,
Absolutely.
if people are looking for a pelvic floor therapist, you can go to, there's a national website. Either you can go to Pelvic Guru, which is a great new connection for adding all the different kinds of disciplines for physicians and resources for patients and how to locate a PT. There's also our American Physical Therapy Association, the Women's Health APTA.org. You can go to PT Locator and locate a PT anywhere in the country that's closest to you. So,
well, and I think addressing those kinds of things, the
Access.
people who have been through this and then share it with others have so much power. And I often think that, when we have, celebrities or people who are sort of sharing their
Talking
stories
about-
of recovery through, depression or
Yeah,
anxiety
true.
postpartum, that's tremendously helpful to other women who maybe feel more alone. So I think we all have such a responsibility for getting the word out there so that people know there's hope and there's help. On the note of resources, certainly at the University of Michigan in the Department of Psychiatry, we have our Women and Infants Mental Health Clinic, where we provide consultation and services around psychopharmacology, but also psychotherapy, and we have groups, all sorts of things that women and their families can find tremendously helpful. And there are resources also online. So Postpartum Support International, for example, is a really trustworthy source of information to really understand more that might help you if you're sort of wondering, where am I in this continuum, or what sorts of options are available to me.
For physical therapy, good to mention too, here in the Michigan medicine system, we're really expanding. So we have locations in Ann Arbor at our Burlington building, Brighton, the Brighton Center for Specialty Care. We have Canton Health Center, and we have Northville, and we also have a pediatric program as well, the PRC clinic on Plymouth Road. So we really try to look at the lifespan of issues and address bedwetting and constipation in kids. So if you're a mom who's also experiencing those issues with your child, beyond a certain age, there's help for that as well.
And our National Urogynecology Association also has a great website for patient resources that you can go to. It's called voicesforpfd.org. PFD stands for pelvic floor disorders. So you can go there and learn more about urinary incontinence, prolapse, fecal incontinence, pelvic pain. They have some great handouts on the types of perineal lacerations, so you can get all kinds of information to see, if you're wondering if you have a certain pelvic floor disorder and what the treatment options are. It's a great resource to go and get that information.
That's great, thank you. Okay, so I am an aqua cycling instructor, and I can't wait to get back to that and running again after the baby arrives. When can I return to my normal exercise routine after birth?
I think both of us?
Yeah.
I mean, go ahead.
Together. Yeah.
Go ahead.
So I get this question a lot also in clinic, and it kind of depends on what your normal exercise routine is. It sounds like you are a very active person, which is great, and we want you to get back to doing those things as soon as possible. So, there's no specific time. I encourage women to kind of gradually increase their level of activity day by day as they feel up to it. So there are going to be some days where you're tired and you just need to rest and sleep, and that is totally fine. But walking is certainly one of those activities that you can get back to slowly. Start with short walks and kind of increase. The nice thing about, I don't know what aquacycling is. That sounds really interesting. It sounds very low impact though, which is, if it is, you can kind of resume that whenever it's comfortable for you. So if you've had a perineal laceration or perineal tear, sometimes that can cause discomfort with the bicycle seat. But as long as it's not uncomfortable for you, I think low impact exercises like the elliptical, the stationary bike, I think those are great. Jen, what do you think?
So I think that you, one, need to listen to your body and allow yourself to heal. One of the things, we try to guide people as they're going through the rehab process with us, and just helping you to find your core first, and get back to exercises that are low impact, definitely initially. Anytime you're getting back into a workout regimen, I always tell people go about half of what you did before. So, if you're a runner, let's start with walking and let's work back into running. You need to allow the body to heal. Like Carolyn said, there's a time frame for us to heal as well. Usually that first few months you're really healing. I know I've had 2 cesareans myself. Might have pushed it a little too quick, but physical therapists were kind of the worst patients, I'll just admit that. But you really do want to give yourself time to heal so you don't injure yourself, and so I think that first 3-month window is really important for the rehab, and if you are concerned about how you're feeling and if you feel like your core is weak and you're having these pelvic floor issues, definitely see a physical therapist, because they're going to guide you back in that right direction. And what Carolyn said is so true. If you had a perineal laceration or if you're experiencing pelvic floor pain, probably riding on a bike is not the best thing to start with. Things like even an elliptical would be better, or walking on a treadmill, going out for a walk. Light jogging eventually is okay. For women now that have pelvic organ prolapse, we definitely have more advanced treatments in physical therapy and exercise protocols that we teach, so we can actually get you back more to those exercises that you like to do with less of that sensation. And that does depend on the grade of prolapse that you have, but know that there is something that can help you.
Thank you. Many people know how helpful a birth doula is. Would you recommend a postpartum doula just as much, if not more, during the 4th trimester?
That is a good question.
So I'll speak to that. First of all, I have said already, and I think this is hopefully really clear, that support during that postpartum period is so, so important. And there are a variety of different sources of support that people tell us that are really important to them. And it might be a parenting partner, spouse, it might be a dear friend, it might be a mother or mother-in-law, someone who can really come in and provide the help and support, and maybe even some guidance that really most women find very beneficial. I think through the ages, women during the postpartum period have relied on other women to support them during the postpartum period. I always think about sort of the wise woman who really helps us. Unfortunately, maybe in many ways, our families now are often much more isolated and spread out, and we don't have that kind of sense of community always where people can come in and really step in to offer support as it's needed. So I think that postpartum doulas can be tremendously helpful as knowledgeable sources of support in baby care. Also, really, really important to me is sort of thinking about who's offering mom support for sleep. Because particularly when women are struggling with mood, the number one thing we want to attend to is what's happening in mom's sleep. And I think the first prescription pad that comes out usually in our clinics is one that has to do with making sure that mom has the sleep that she needs. And obviously, postpartum sleep is not easy to come by. And so often what we need to do is think about who are the folks who we can bring in, who can offer mom you know, several nights of extended hours of uninterrupted sleep when sort of mood is disrupted. And that can really be a tremendous help in terms of a reset. So a postpartum doula can sometimes help with that, a nighttime doula, for example. So I think having someone who's coming in, a doula or others, I think we all should have done that.
That is sounding wonderful.
I think you're going to have a lot of women dialing in on that.
I think it can be tremendously helpful. And actually, when someone's struggling with mood and depression, I think it's more than just wonderful. It's actually medically necessary to really help them with getting the sleep that they need.
Yeah,
So,
that's very important.
yeah.
Thank you. That's great information. It looks like we have time for about one more question. So what can employers do in order to make the transition easier or more comfortable for a mom when she's returning to work?
I think give her the time that she needs and work with your, sorry, I didn't mean to jump in, Carolyn. Work with your employer and the employee relationship. Work together and do what you feel you're ready for and comfortable for.
Yeah, I think the short answer is listen to women. Ask them what they need. Because, you know, individual women may need slightly different things. I mean, if women are nursing or breastfeeding, then obviously they need support. They need time to be able to breastfeed. They need a private space in order to do that. They need a place to store their milk during the day. And sometimes those things can be really awkward and difficult conversations to have, and women might not feel empowered to ask that from their boss or their supervisor. But I think if that's initiated by the supervisor who says, you know, I know this is a difficult time for you or can be a difficult time, what can I do to support you? I think that can go a long way.
Yeah.
Good.
I would absolutely concur with that. And I would say actually listen also to dads and think about how it is that we support whole families during this incredible transition and during this very intensive parenting time. How can we provide support? Is there flexibility in shifts or sort of hours or in how things are happening? And being aware and really listening to what the needs are, I think, can go a long, long way towards helping families adapt, cope, and succeed in this sort of, you know, big, challenging, and wonderful transition into parenthood.
I concur as well.
Yeah.
Thank you. Okay, well, we are closing in on the end of our chat together today. So Dr. Swenson, Dr. Rosenblum, and Jen, I want to thank you for sharing your time and expertise today. That was great information. For more information on our Healthy Healing After Delivery program, please call 877-462-6935. If you would like to see one of our psychologists about postpartum depression, please call 734-764-0231, or you can visit the UM Department of Psychiatry website to learn more. We also have a wealth of online resources on a number of women's health topics. You can check them out at www.umwomen'shealth.org/women's-health-resources. Thank you to our audience for spending part of your afternoon with us. We hope today's chat has been helpful. We have a brief survey we've prepared to help us learn how we can make chats like today's more helpful to you, and to help us identify more topics you'd like to hear about. Please be sure to check the comments to this video, and we'll have a link there for you to follow. Once again, thank you for joining us, and have a wonderful afternoon.